In this lecture, we will briefly review the nerves of the upper and lower limbs. In part 1, we will review the brachial plexus. In part 2, we will review the lumbosacral plexus. It will be important for you to have a thorough knowledge of the brachial plexus because it is responsible for both cutaneous and muscular innervation of the entire upper limb. The brachial plexus is typically organized into 5 parts: roots, trunks, divisions, cords, and branches. There are 5 roots which correspond to the spinal segment origins of the brachial plexus. These are essentially the anterior rami of the 5th cervical through 1st thoracic spinal nerves. Typically, 3 nerves emerge from the brachial plexus at the level of the roots: the dorsal scapular nerve, which arises from C5, the long thoracic nerve, which arises from C5, 6, and 7, and the subclavian nerve, which arises from C5 and 6. There are 3 trunks, which are the area where fibers from different spinal segments first mix. The C5 and C6 roots merge to form the superior trunk, the C7 root remains independent and becomes the middle trunk, and the C8 and T1 roots combine to form the inferior trunk. Typically, the only nerve that emerges from the trunks is the suprascapular nerve, which branches off the superior trunk. The trunks then divide, each into posterior and anterior divisions, to form the 6 divisions of the brachial plexus. Thus, the anterior and posterior divisions of the middle trunk only contain fibers from the C7 root. The anterior and posterior divisions of the superior trunk both contain fibers from the C5 and C6 roots, while the anterior and posterior divisions of the inferior trunk contain fibers from the C8 and T1 roots. Normally, there are no nerves that branch off at the level of the divisions. Variation does exist, however, with some reports suggesting the medial pectoral nerve is more likely to arise from the anterior division of the inferior trunk than the medial cord. There are 3 cords that represent the next site at which fibers from different spinal origins mix. The lateral cord is formed by the merge of the anterior divisions of the superior and middle trunks. This has fibers from C5, C6, and C7 and gives rise to the lateral pectoral nerve. The medial cord is formed by the continuation of the anterior division of the inferior trunk, which has fibers from C8 and T1. It gives rise to 3 nerves: the medial pectoral nerve, the medial cutaneous nerve of the arm, and the medial cutaneous nerve of the forearm. The 3rd cord is the posterior cord. This cord is formed by a merger of the posterior divisions of all 3 trunks. The posterior cord contains fibers from all levels, from C5 through to T1, and gives rise to 3 nerves: the upper subscapular nerve, the thoracodorsal nerve, and the lower subscapular nerve. There are 5 branches of the brachial plexus, which represent the termination of the cords into named nerves. The lateral cord gives rise to the musculocutaneous nerve and half of the median nerve. The medial cord gives rise to the ulnar nerve and the second half of the median nerve. All 3 of these nerves serve the anterior compartment of the arm, forearm, and palmar surface of the hand. The posterior cord gives rise to 2 nerves: the axillary and radial nerves. These serve the shoulder and posterior compartment of the upper limb, respectively. The anterior divisions of the lumbar nerves, sacral nerves, and coccygeal nerve form the lumbosacral plexus, the first lumbar nerve being frequently joined by a branch from the 12th thoracic. As with the brachial plexus, the lumbosacral plexus is of particular importance to us because it innervates the entire hip region and the lower limb. The lumbosacral plexus is made up of the lumbar plexus, the sacral plexus, and the coccygeal nerve. The coccygeal nerve can otherwise be referred to as the coccygeal plexus or the pudendal plexus. The lumbar plexus is comprised of the ventral divisions of the first 4 lumbar spinal nerves, which contribute towards the makeup of the femoral, genitofemoral, lateral femoral cutaneous, obturator, ilioinguinal, and iliohypogastric nerves. The lumbar plexus also contributes a tract called the lumbosacral trunk, made up of the anterior divisions of the 5th and 4th lumbar nerves to the sacral plexus. Next, I will highlight some of the nerves that are particularly important for you to know, their origin, the muscles they supply, and their various divisions. The femoral nerve arises from the ventral rami of the spinal nerves L2 to L4. It supplies the quadriceps, sartorius, iliacus, and pectineus muscles, as well as the skin of the anterior thigh. Divisions of this nerve include the saphenous nerve, nerves to the anterior compartment of the thigh, and the anterior cutaneous branches. The obturator nerve arises from the ventral rami of spinal nerves L2 to L4. It supplies the muscles of the medial thigh and skin of the distal medial thigh. This nerve passes through the obturator canal and gives off anterior and posterior branches. The superior gluteal nerve arises from the ventral rami of spinal nerves L4 to L5 and S1. It passes through the greater sciatic foramen to supply the gluteus medius, gluteus minimus, and tensor fasciae lata muscles. The inferior gluteal nerve arises through the greater sciatic foramen to supply the gluteus maximus muscle. The sacral plexus is a nervous plexus comprised of the anterior divisions of the first four sacral spinal nerves, along with a contribution from the fourth and fifth lumbar nerves. The sacral plexus gives rise to the common fibular and tibial nerve roots. These roots converge and descend as the sciatic nerve. Other branches of the sacral plexus include the posterior femoral cutaneous, medial cluneal, pudendal, and superior and inferior gluteal nerves. Let's focus a little more on the sciatic nerve. The sciatic nerve arises from the ventral rami of spinal nerves L4, L5, and S1 to S3. It is the largest nerve in the body with both motor and sensory functions, and tibial and common fibular divisions. From its origin at the lumbosacral plexus, the sciatic nerve travels into the pelvis via the greater sciatic foramen, then inferior to the piriformis, through the gluteal region and into the posterior aspect of the thigh, deep to the biceps femoris. In the thigh, it gives off branches which supply the semimembranosus, semitendinosus, biceps femoris, and adductor magnus muscles. The common fibular and tibial nerves separate from the sciatic nerve in the thigh. The common fibular nerve, or common peroneal nerve, arises from L4 to S2 as part of the lateral aspect of the sciatic nerve. It branches from the sciatic nerve proximal to the popliteal fossa and continues to the lateral side of the leg where it curves around the neck of the fibula. It then passes under the fibularis longus where it divides into terminal branches: the superficial fibular nerve and the deep fibular nerve. The common fibular nerve supplies the short head of the biceps femoris in the thigh. Through its terminal branches, it supplies all muscles in the anterior and lateral compartments of the leg: the extensor digitorum brevis on the dorsal aspect of the foot, the first and second dorsal interosseous muscles in the sole of the foot, the skin on the lateral aspect of the leg and ankle, and the skin over the dorsal aspect of the foot and toes. Damage to the common fibular nerve can cause foot drop. Foot drop is an inability to dorsiflex the foot and is characterized by patients having a stoppage gait. The tibial nerve arises from the fourth and fifth lumbar nerves and from the first three sacral nerves. Branches of the tibial nerve include the medial sural cutaneous nerve, the medial calcaneal branches, and the medial and lateral plantar nerves. The tibial nerve is the larger of the two divisions of the sciatic nerve. The final group in the plexuses is the coccygeal plexus, which is also known as the pudendal plexus. These nerves innervate the coccygeal muscles and contribute branches to the coccygeal nerve to form the anococcygeal nerve, which innervates the skin of the back of the coccyx. The pudendal nerve arises from the ventral rami of spinal nerves S2 to S4. It supplies the pelvic floor, including the superficial and deep transverse perineus, the external anal sphincter, bulbospongiosus, sphincter urethrae, and the urethrovaginalis muscles. This nerve gives off inferior anal, perineal, and dorsal branches. And that concludes this lecture, providing you with a brief overview of the brachial and lumbosacral plexuses. This lecture was prepared for students enrolled in the UCD School of Public Health, Physiotherapy and Sports Science. Images were taken from the Complete Anatomy software prepared by 3D4 Medical.